Call to order, Human Services Committee meeting. Is there any courtesy of the floor? Seeing none, could we have an update on Graysdale? Thank you.
Thank you.
This is June, right? Yeah, we're in
Yes.
July.
Okay. For admissions, just want to let you know we are back on a budget of 670. That is our benchmark. So we're definitely doing better with our admissions. Of course, we're going to continue to maintain census at or above budget at all times. Any questions about admissions before I move on to finance?
Private pay admissions are down.
Private pay admissions are, yeah, slightly down. That means we usually get in more. We probably get in more rehab, but yeah, slightly more rehab and higher Medicaid.
Okay.
Any other questions before I move on? Okay. Our finance, our cost per resident day went up slightly, and so did our year-to-date cost per resident day. Days in account receivable are going down, and our case mix index has gone up to 0.89, which is good. Any other questions with regards to finance before I move on to Medicare reimbursement? Yes. Oh, I thought you were going to ask a question.
No.
Yes.
Yeah, I'll ask one then.
Sure.
We did receive the audit for 2017, and according to the numbers that we got, for the operating, not for capital, you ran approximately a $500,000 surplus. Is that correct?
Yes.
Okay.
All right.
No, I believe at the end of the year, you told us that we were expecting a deficit of, I think it was a few $100,000. What was the difference between back in January, February, or even it was January, February? You told us you expected, I think, about a $400,000 loss. And we got the audited report, and it, it's almost a $500,000 operating surplus. To what do you attribute the swing between your prediction back in, maybe February and the audited report?
It would be probably collections. We were able to recoup a lot of the monies that we had, and that's what I was, when I spoke with the fiscal administrator, he had indicated that we were actually doing much better. It's just that a lot of it accumulated after the end of the year, towards the beginning of the year. So that's why we ended up going higher because of the collections.
Okay, so items that were billed in 2017, it took you that long to realize the payment for those? Is that the issue?
It's also the collections that are involved in getting it. I mean, that took some time for us to get. So that's really what caused the delay.
Mm-hmm.
Yeah.
Well, I mean, not that I'm complaining. I mean, for some of us that are sitting here, to see a $500,000 surplus in operating is, it's excellent work. I know we're still putting in a lot of money in capital, but that's from where we were maybe 5 or 6 years ago. It's a stunning improvement. So.
Yes. Thank
Congratulations.
you. Thank you. Any other questions? Okay, I'll go ahead and move on. All right. With regards, I thought somebody had a question. With regards to Medicare reimbursement, we're slightly lower in June than we were in May, and also with our average net per diem slightly lower. Our Part B revenue remains the same. So we're doing pretty well with Part Bs. But usually that's what happens when your Part As come down, your Part Bs go up. Any other questions before I move on to nursing?
On Medicare reimbursement, it's my understanding that the state budget includes a 1% increase. Has that been factored into the budget at all?
Yes. Yes, I spoke with Peter about that, and that has been factored in.
Okay, thank you.
Yeah, you're welcome. Any other questions? Okay. With regards to nursing, we're still moving up in our PPD. We're at 2.97. Our which is slightly higher than last month, still under 3.2, but we continue to utilize aggressive recruitment strategies, to go ahead and get in more staff. On the 25th, we are going to have a job fair, so we're very excited about that, to go ahead and recruit more RNs, LPNs, and CNAs, as well as any other people who want to apply for a job in the dietary, housekeeping, etc. Okay, our RN, CNA overtime is trending downward, while our LPN OT is trending slightly upward. However, RN, LPN, CNA agency have remained the same since last month. Any other questions on nursing before I move to compliance risk? Yes.
What's the job?
The 25th.
July.
Yes.
Next week.
It's going to be from
Wednesday?
10 to 6. Okay. Any other questions? All right. With regards to our compliance risk, there was one anonymous complaint visit from the Department of Health that was unsubstantiated, so no deficiency was received. Okay. Any other questions before I move on to quality measures? Okay. Quality measures are trending positive, with the exception of a slight increase in short and long-term pain, weight loss, and total facility pressure ulcers. However, facility-acquired pressure ulcers and total number of residents with pressure ulcers are also trending positive. So that's good. Any other questions on quality measures before I move on?
I guess the question about pain, do you think that's, do you have any concerns about that? Or do you think those are admissions or?
Yes, I mean, it can be a combination. It's probably mostly admissions and who we're bringing into the facility. They have more medical concerns, and we have to treat the pain and go ahead and relieve it. So it'll take some time to lower a little bit. And we have gotten an increase in our admissions recently. Any other questions about that? Yes.
It's kind of I don't know, it's not a question. I guess there's a concern about opioids being used for painkillers. Is there any kind of reduction? I'm sorry. Thanks, John. Is there any kind of reduction that's going on in the painkillers that's in those programs right now at Graysdale?
Yes.
Okay.
I mean, we are actively looking at with our pain committee and to do everything we can for our residents, because we don't want them to become addicted or anything like that. We want to use other methods if possible to try to alleviate the pain.
And the only reason I bring it up is that study that we heard was largely 55 and up, mostly through dispensed painkillers.
Right.
And I thought about Graysdale, and I thought about hospitals, but I just was curious. That's
Yeah.
all.
Well, we have what's called medication reconciliation, where we look at the medication and see what's necessary and not necessary and try to wean people off it, just to give them a better quality of life. And that's a huge thing at Graysdale.
Yeah. Thank you.
So how do you rate short-term and long-term pain? Like, what measures do you use to rate? Like, how do you get to those numbers?
Oh, short-term is the short-term stay residence, and long-term is long-term stay residence. Is that what you meant? Or
Well, okay, so then how do you get the percentages of, you say, who's in pain? How do you get that data?
Well, that's the data that we submit to our minimum data set, or MDS assessments. That goes into the CASPER report, which is a report that comes back to us from CMS, Center for Medicare and Medicaid Services, to let us know where we are percentage-wise compared to state and national averages.
What does it measure, though? How much pain each resident?
It is subjective,
Yeah.
because you do have individuals, like someone could wince and say that they're in pain, and if you touch them in any part of their body, they could still be in pain, whereas someone who has specific pain, you know what I mean? You're going by their reaction to pain. There's a pain scale,
Right.
and it goes from like slight discomfort all the way down to tearfulness, and you have to really focus on where they are. in relation to the pain. So you have no other way to measure it other than that.
How does that affect that number, though?
Well, I mean, this is pretty much the way that all nursing homes assess pain, so it is the same across the board, for all nursing homes in terms of the level.
Are you using a different scale than they would use in a hospital? Because hospitals pretty much use Joint Commission is a pretty standard pain scale. So you're not using that at Graysdale?
No, it is. It's the Braden scale, which is the pain scale, and it's similar because that's the reaction you have to go by, is how they're feeling, if they're in pain or not. And it's hard because you have some residents with dementia who, because of what's going on cognitively, they may not be able to feel that pain, in the same way as someone who is able to express themselves. But you try to do your best to get an idea of where they are.
Okay. Go ahead, Joe. Go ahead.
So I understand this myself. The pressure ulcers total facility, in parentheses, you have 2%, and then the benchmark is 13. Now, is that 2% of the facility?
Yes, 13 should be 2% of the facility.
Okay, so that's, when benchmark, by that do you mean, is that like a state or federal number, or is that, what does that mean?
That's CMS. That would be the national percentage, which we use as benchmark for all of these numbers here.
The 13?
Yeah.
So that should be a percent behind it, 13%?
No.
No,
2% is 13 residents.
Okay, so
Represents 13 individuals.
in going with that, I'm looking, it seems to be about the same, but in February we spiked up to 88, then we stayed down to 50s, 40s. Then in June it spiked up to 84. Is there a particular reason, or is there any understanding on that? I mean...
Yeah, we had an increase in the number of pressure ulcers at that point, so that's why we were a little bit higher. And now we're doing our best to come down again, but we're looking at total facility, which means not just the ones in-house,
Right.
the ones that come to us. So we could have gotten sicker people who are, in a sense, have these pressure ulcers, and then we have to heal them. So a better number is to look at the number of healed, because that's what we've taken, what we've gotten, and the results that we had with them. So.
All right, so the 13, the benchmark, that's the number that they're saying you should have or would be best, even with your number of patients you have, or residents, I should say.
Yes,
13.
2%
Wow.
is the national benchmark. We should be at 13, no more than 13 residents. So we have, continued work to do, but we are definitely improving.
No, I don't even know if there's any facility in the area that would be able to come in at that. That's a low number.
Yeah.
But anyway, I was just curious, but thank you. You cleared that up.
And that's 2% of 688 beds. Yeah. All right, any other questions regarding quality measures? Okay, we'll move on. Satisfaction survey, everything is looking good. We're close to 4. We had 57 out of 57 surveys, 24 came back. Our human resources, our 6 call-outs have decreased, while our FMLAs and IFMLAs have slightly increased. And RN turnover rates remain at 0. LPN turnover rates are down, while CNA turnover rates are slightly up. And our CMS star rating remains at 2 overall, 2 regulatory compliance, 3 staffing, and 3 quality measures. Any other questions? No? All right, thank you very much.
Report.
Can I just say something? Yeah. I was at Doughboy's Pizza last Friday, and there I saw Chris Dawson with a group of people from Graysdale, and I think it's great. They were having a great, wonderful time. And the mayor was with them, the mayor who was at our last meeting, and he had a severe stroke the next day and passed away on Monday.
Oh, yeah.
It's unfortunate, yeah.
That was so
Who was
fast,
that?
but he seemed so happy and
Mr.
fun
Dunn.
and happy to be
Ken
out and all, so I know he's been at our meetings sometimes.
Yeah.
Very vocal. Yeah.
He was very excited to come to the meeting. He was
But
really looking forward to it and talked about it a lot, and was very happy to have been there.
he was so happy at Graysdale, he really was so happy, and Chris Dawson just does a great job.
Yeah, Absolutely. All right, thank you very much.
Thank you. Report on Veterans Affairs Division.
Oh, I was not there. I was in-
Good evening, everyone. For those of you newly elected officials, my name is Fred Ramirez. I've been in this position for 6.5 years. Before that, I was the sheriff's deputy before the promotion. My job primarily entails assisting veterans and family members of veterans apply for county, state, and federal VA benefits. That includes compensation, veterans claiming a disability they believe was incurred while they were in the military. A lot of my veterans are still Vietnam vets with the Agent Orange exposure and other types of herbicide exposure. And unfortunately, a lot of my widows are Vietnam vet widows, those who have passed. They seem to be the ones who are dying at a really quick pace. My caseload has increased due to the Warren County losing their Veteran Affairs office a few years ago, so I am getting veterans from Warren County, whom I'm assisting with no problems, and in the Lehigh Valley itself, for whatever reason, they come to me. That's basically it, unless anyone has any specific questions.
Go ahead.
Do you have enough help?
There's 2 of us. I'm the only certified.
know.
I'm the only nationally accredited service officer, and nationally accreditation means that I'm able to go to any of the other 49 states and perform the same function without taking any additional training. The training I receive is good for the whole country. If I was accredited through Pennsylvania, other states may not accept that accreditation. So then I went for the national one, which is accepted on all 50 states. We can always use help.
But I know how much work you do, and I appreciate what you did when I needed it and my family needed it.
You're welcome.
Okay.
Just one quick thing, grave markers, how is that going? Do we have enough, and are we getting them out there in a timely manner?
Yes, they're always distributed on Memorial Day with flags as well, and we distribute them as they're requested. The flags, that always increases the request for flags because obviously, circle of life, people die. There's no real number to put. If anyone was to ask me how many you think we're going to need next year, there's no way of knowing that. So we order every year, Stephanie and I, my assistant, we will order grave markers at least an extra box. World War II, we would order extra boxes, and there's 25 to 50 markers in a box depending on the vendor, because every year we have to go through the bidding process, and our vendors have been changing. So
Yeah, and that was my next question. Are these, are they available on state contract, or do you have to go out each year to bid them?
every year we send out to the companies that provide the grave markers, and then they submit the bids. We forward them to purchasing and procurement, and they make the decision who
They're
gets
all
the
they're all
contract.
made in USA.
Yes,
right?
they are, as well as the flags. There was a question about that last year from one of the vendors. A lot of families and veterans themselves were asking, and I made sure that they were in fact being made in America, because I'm part of a co-op, and this co-op includes Northampton, I believe Monroe. It's like 5 or 6 counties. So this was decided way before my tenure that it would be, everyone would get a much better price per flag than ordering it everyone individually through different companies. So, and we're still in that co-op, so I figured it's the best of both worlds. But yes, they're American made.
I have a question, unrelated topic. Is it still the local VFWs that put the flags? I know that one time we'd get the flags, and then the VFW would put them out. Or do you?
I thought Boy Scouts did.
Or I don't know.
Right. We have a list of all the organizations that actually come to the warehouse at the Wolf Building, which we still store them, and that's where we distribute the flags. They, in turn, seek out volunteers and they're usually Boy Scout troops that will place them on the cemeteries, on the gravesites.
Now, you said as a request, I know a couple people came to me, in fact, and in one case it was my wife, for my father-in-law. She said, hey, there's no marker or no flag. He's World War II. Would a request be made to your office if one's missing on
Yes. Yes, we have them in the office. Memorial Shrine, that's usually where we get the most requests for replacements. For whatever reason, they're missing, whatever the case may be. I have spoken to the one of the managers there. We're on good terms. So I would give them markers, but they run out of them so quickly, and then the office staff there just refers them to us, and they'll come down and.
So if somebody, like for example, if somebody says, "Hey, my father or my father-in-law doesn't have a marker," would you call your office and then pick it up directly?
That is correct. Yes.
And I just wanted to find. I know in the old days, the old brass, the ruptured duck ones, they were flying because people were stealing them. So are you using resin now? I mean, I don't even know how many of those old ones are left. Are you still using brass?
No, everything now is aluminum.
Or was it copper? I forget. Was it copper?
Both.
Both. Yeah, I thought copper, brass. Yeah. Well, that's.
Yeah.
I'm before some time too.
Everything now is aluminum.
Okay.
And what's good about this vendor we're using now is that they're putting property of Northampton County or from Northampton County in case there is a theft and the police can identify it.
Yeah.
That it was issued by Northampton County.
Okay. Well, thanks. You've answered.
You're welcome.
I have some questions.
Yes, ma'am.
What programs are you offering currently for Northampton County vets specifically?
This was started last year or the year before. We initiated a county discount ID card, which we issue for county resident only, and they must show proof of their honorable discharge. Obviously, those who receive this honorables or other than honorable are not eligible for any kind of benefits through the VA, so I will not give them a discount card as they didn't earn it, so they're not getting it. We do have a list, and we're probably 200, 300, 400 ID cards we've issued. And I've put it out there to the Lehigh Valley Chamber of Commerce last year to see if we can get merchants on board, and only 2 signed up. So, but I've been told by veterans who have the card that some businesses, a lot of businesses, are accepting the card and will offer their discount. And we explain to the veterans, this isn't an automatic. You can present it to a merchant, and they can decide whether to accept it or not. And if they accept it, whatever the discount is. You do not go in there and demand anything. This is not a given. Because in reality, even with the federal government, there is no discount card. They receive federal VA identification cards saying that they're either service-connected or they're in the VA healthcare system, and everyone calls. The government, supposedly, President Obama, this signs into law offering a federal discount ID card. Who's going to pay for the card? That's the question. So that card has not been issued because the federal government says, yes, the president signed off on it, but we don't want to pay for it. So now it trickles down. Nobody wants to pay for that card. So it's in limbo for that program for the federal discount card. And again, merchants don't have to accept the card. It's their business. They decide how and when, if they want to offer discounts.
So that's the only service that we have for Northampton County vets?
Yes, everything that I do goes outside.
What does that mean?
Because they're coming in for benefits either through the state or the federal. The 95% probably, they're requesting assistance or benefits from the federal VA because they're the ones that approve whether they meet the requirements for compensation, again, service-connected disability, or for a pension, which is just a stipend to help try to offset medical expenses.
Lori, he helps fill out the paperwork so they can
Exactly.
help them get through the process of it. So, because obviously it's federal, support that they get, but he helps them.
Just hold that thought.
But obviously, with a lot of our veterans, some of the paperwork is cumbersome, so he helps them fill it out and get them through the channels. So, does that help? I'm sorry.
Right. I basically fill out the paperwork, and they just come in with the required documents that I ask them to bring. Remember, a lot of these veterans are much older in age. They're not computer savvy. So,
Well, traditionally, that's always been the way our Veterans Affairs and county ones operate, right? I mean,
correct.
you help, you conduit. I mean, I know going way, way back when my father was still alive, I came in and, God, that was going way back. But, I mean, you don't have the resources. It's all state and federal, and you help everybody get the paperwork done. And
Correct.
In fact, I know I referred my brother-in-law to you recently, so,
Correct.
okay, that's what I thought.
Maybe a good question to ask, Fred, would be, how many questions on a basis of a percentage, let's say 90 or 80%, do you get on how much health insurance is coverage, Medicare, Medicaid, all that for a veteran versus a discount card? Okay. I would say
wow. I would say 70-30 requesting benefits from the VA.
I would think that's the majority of your just
Right.
always asking that.
Right.
If you needed help or assistance in anything, I would think.
I know I have it sitting on my desk at
And then
home.
the discount card to
Nobody
me
helped
is
us fill it out.
level because, there are websites and there are sites available for veterans to go to that they can find local discounts for veterans.
Correct.
I guess, so you really just do paperwork? No offense.
No, basically.
'Cause I
that's
asked
what do. Yeah, basically that's what I do. Yes. No offense taken. Yes, that's.
Well, because, no, but I guess what I'm asking is because when I think about vets and I think about all the problems that they're facing, like I have one that lives in my house, and we still haven't been able to figure out how to fill out his paperwork, but that's okay. And like, what are we doing about homeless vets? What are we doing about vets? Like I heard from District Attorney Morganelli that the next court that he's looking into, like adopting, is vet specific because they seem to be gravitating toward some, criminal activity based on their homelessness or theft or vagrancy or whatever. So
Right.
what I guess, like with all due respect to getting these benefits done,
Right.
what else are we doing in this county for our veterans? And does that not go through your office? Or is that not handled by you?
That is not handled through my office, as if, for those of you, Judge Daly, he's in charge of drug court, and if a veteran goes through there, then drug and alcohol makes the assessment, and at times, the drug and alcohol case manager, well, whatever that title is, they will let me know if there's a veteran involved, and is there something I can help.
And is there?
I'm sorry?
And then what can you do?
Well, again, it depends what help they're seeking, and basically, as you said, ma'am, it's just navigating and helping them with the paperwork. I make referrals. If someone, I just had a call today about a vet that's maybe homeless tonight, so I gave the St. Luke's, the social worker over there, contact information to call to try to get them into Victory House or any other facility. I basically just get the information and then tell them who they should reach
Right.
out to, because
That's not your purview, so you just farm it out to
That is correct.
whoever's responsibility it is, right?
Correct.
Okay.
Correct.
And could I ask a question?
Yes, sir.
I just wanted to ask if I may.
Matt was next.
Oh, Matt, go ahead. Sorry, Madam Chairman.
I make a recommendation. Maybe one time there's the Valor Foundation. I don't know if you've heard of them. They're from Monroe County. They came in once and spoke, and I visited a facility up in Monroe County, and they actually do a lot of work in Northampton County. They call it stand downs. They do a couple spots in Easton, Bethlehem, and they go actually out. I mean, literally in the woods under bridges and help reach out to the homeless. Of course, a large percentage of them are veterans. And then they run a clinic of 12-week course like that, and where they have to go through a rehab, both eating, training, and help get them on their feet and work. But I know at one point they did look at trying to get a facility here in the county somewhere, and so I love that putting in contact with them, and I think they're a great resource to go out and help the homeless directly, hands on with them, and they're always collecting.
Because when I think
Hope for Veterans is the other organization
what's it called?
Hope for Veterans. They're another organization I work closely hand in hand. Again, unfortunately, when people come in and say they have an emergency, can the VA help? Nothing is quick with the VA, with the federal VA. So it's easier for me, being in the same, Human Services, being in the same building, someone comes in with a mental health issue, I go right over to IRIS, Information Referral Emergency Service. They have the caseworkers there that can interview the individual, which has happened on numerous occasions, and they're able to get them the help almost instantaneously than the VA can ever do. And that's the thing that happens with the VA. Nothing works fast with the VA. It's just the nature.
Do you keep any kind of data on who walks in your doors?
If I help them start paperwork, that would probably be the only data. When I receive phone calls and people want me to call them back, I do have a list of that. I average 15 to 20 phone calls just on my line itself. We have 2 lines. Stephanie, my assistant, she handles the burial, anything other than claims. That's what she handles. The ID card, taking the photo, making sure they're eligible for that program. Walk-ins, I can average 5 to 10 walk-ins a day.
Yeah, so that's, I guess my question is, what are some of their concerns? Like if I walk in, what are they asking you for? Because I would assume that people are deployed elsewhere, coming back here, coming back home. I'm just curious about a lot of different data. I'd like to know what the breakdown of veterans you see. Like you said, you have a lot of Vietnam vet. Well, I still have a World War II vet in my house. How many are, from the different
the majority of my
wars
clients,
or different
yes.
Missions that they've been
Yes, the
on.
majority of my clients are Vietnam War veterans. The second, I would have to say, are World War II vets. I don't get too many Korean War vets, believe it or not. And now I am getting a slow influx of the Persian Gulf, Iraq, Afghanistan. But they're still at the lower end. I would think I would have more clients from the Persian Gulf, Iraq, Afghanistan than I do from Korea. I don't know why.
But you're not tracking what their concerns are other than the paperwork. Like you don't have a system where you're measuring, or somebody came in for this, or how many mental health requests came in, or how many drug affected, or any of those calls. You're not tracking any of that data?
No.
Is there a way to track that data?
I can probably start a there you go. I can never remember that word. Thank you. I can probably start doing that, but it's the clients are so regular. That's how I know Vietnam, World War II, and the other wars. And I would have to say maybe 60% of the clients are still Vietnam War vets, and then World War II after that, and then all the other wars. And the least amount would have to be Korean War vets. They would have to be the ones I helped the least.
Go ahead.
Okay.
I forgot. I'm sorry.
Am I allowed?
Yeah. No,
Right,
I just now had his hand up. I just did want to honor that.
You actually said this a bit, but I know for years and years you were a standalone department, and you reported directly to the county executive or the director of administration, and then you were folded in a few years back into Human Services. And you did mention now, when you come in, you can move people. And I was part of what I wanted to know was, has that? I guess you weren't here before it was folded in.
Correct.
So I wondered if it was made it better. And I would say probably for people coming in, and I know most of the people I know are Vietnam vets. I think, I mean, for what you do, really, I don't know if you could quantify it or what the numbers would mean, but I know it's on a very personal level, because I know people will come up to me, and the Agent Orange thing is huge. I mean, and I know for years the federal government wouldn't even acknowledge.
Right.
Do they finally now begrudgingly acknowledge?
And they have a list of presumptive disabilities.
So, I mean, and I guess that's probably still going to balloon for a while because some of us have a few years to go. But the thing is, I know when I've referred people and they talk to me, I almost get the sense they don't want to be. They come in and they just want to personally talk to somebody and say, help me, this is a mess. And the mess is at the federal and state levels. I mean, we can't, but then again, so now you do, though, when possible, you're saying, hey, if somebody comes in and it's a mental health, or I say, hey, you can go right over to Iris here and you help them out.
Correct.
Okay.
Correct, because if they're insisting on VA, and a lot of them that do come in for mental health issues, all they want to do is speak to someone.
Yeah.
I'm not a mental health professional, so I go next door to Iris and get a professional who can speak to them, and that has happened.
I know that a lot of the guys are young now, but I'm going to guess going forward, since we've been with war now for what, since 2002, pretty much nonstop.
Forever.
Yeah, I mean, I know it's a Valor at this point, you know, but still, I'm going to sense that somewhere down the road, your type of offices are going to get swamped. I mean, we're in a perpetual state of war. I mean, and it's not the 1 year and out that it used to be, as bad as that was. It's these continuous. Are you seeing some of those? I mean, continuous deployments that just. I got to give these guys credit. I don't know how they do it, but I'm sure you're getting a lot of PSTD and things like that.
Well, that's what, again, that's on my list too. How are we tracking PTSD? Do we have any grants pending to try to get assistance for these folks? Are we working on any, I mean.
Not on the county level. Everything's.
So you don't have a pipeline to the federal that we could.
I had a son-in-law served 5 quarters in Iraq, okay? Came back, and he gets his help from Wilkes-Barre.
Mm-hmm.
Yeah.
That would exceed and go above what the county would do, and he lives in Bethlehem, or didn't live.
And they had the one in Allentown too, but I guess they downgraded. Didn't they have? They have a center in Allentown for vets.
Clinic.
Yeah, and Wilkes-Barre is the whole full-blown hospital, though.
That's what a lot of these people end up doing.
Yeah. Yeah, that's where my brother-in-law was going. Do they have one near Philly too, a full-blown hospital?
Yeah, Philadelphia VA
But
hospital.
that's distressing.
Well, it is, but a lot of them can't get there.
Exactly. George isn't driving to Philly. Not that George needs it, but do you know what I mean? Like if my dad is the typical person, or anybody who, and he's pretty phically able, somebody who's physically unable is not going to get there for those services. So that's concerning.
To our congressman.
Senators.
Do a resolution to our
If I may.
congressman and senators. The
The only veterans that actually may have to go see a doctor are the ones that are claiming compensation service-connected disability. If a veteran is claiming a pension to help them if they meet the federal requirements based on income and assets, they don't go anywhere. The VA will take the information that I submit and make a decision based on that, as you well know. And what the VA is doing now is they are outsourcing the medical appointments because they know people just can't make it up to Wilkes-Barre, can't make it down to Philadelphia or Lebanon VA Medical Center. They know they can't do that. So they are trying. Since I've been there 6.5 years, it has improved dramatically. Trust me, it was bad 6.5 years ago.
Lori, if I could just add, over the years, everybody, a lot of people came here over the years regarding veterans issues. I've only ever gotten positive comments, not so much about the federal or state folks, but about our veterans office and the work that you folks do. I can help them maneuver the ridiculous red tape that's out there. So I mean, I think it is a valuable service. What you can do, you do very well.
Thank you. Thank you.
And how many attorneys are qualified to practice for the VA?
The federal
in this
VA,
area?
the federal VA has that list.
You don't have access to that for this county?
You know, it's funny you mention that. And not exaggerating, this is a federal VA identification card, which took me over 6 years to get because of the red tape. It still doesn't work. I can get into a VA facility, but I cannot get into their system. And if you see, it has the chip here and everything, and I can't get into the system. And this is what I've been dealing with. And Sue is aware of that. And I'm not exaggerating. I mean, they couldn't even get my name right. I'm not kidding. They could not get my name right.
I don't know that that answered my question, but thank you.
No, this is what I'm dealing with.
I understand. I guess I just know that you're here, and I appreciate what people are saying. I know that I've had my experiences in your office, and that I just think there's so much we could do, that if the feds aren't doing it and we in the county have access or ability, like I think it's great that you get them over to the referral service. That's absolutely wonderful. I think it's great in the same building. They don't have to leave the building or go somewhere else. But if we're not tracking and targeting what they need and addressing those needs, somewhere I think we should be able to do that, or somehow. You know, whether that's through the phone calls, through a computer, if there's any records in the county or the state that we could just plug that data into. There's got to be some way to at least track that so we know what we're dealing with.
Don't they do that at the state or federal level, like at the VA hospital? If someone goes to the VA hospital, they track what it is that they're doing, because they have like med boards and all these other things where they evaluate caseloads and see what the needs are, right?
When I submit a claim to the federal VA, the state VA, they send a record of what every county, the counties that submit claims to Philadelphia. The West, they send everything to Pittsburgh. So what happens is the VA will send some sort of a, what's the term, of the work that's being submitted. And then I get that report monthly. And that report breaks down why the claim has been submitted. Again, compensation or pension. It doesn't break it down for prostate cancer or bad heart or any of that. They don't break it down that far because of federal privacy law and HIPAA laws. But they do send me a record of all the claims that have been submitted monthly, either for, and they one of two things: compensation or pension.
If they have anything else?
I just think if they send us the county council to Washington for 6 months, we clear all this up. That's all.
Probably.
Unsolicited comment.
And again, that's the reason why I'm passing that. I mean, Freddie Ramirez Jr.
Fred, you do a fine job with 2 people in your services. If we can get any more people in to help you, I'm sure we'll bring it up.
Appreciate that.
Thank you. Thank you for your time.
Thank you, everyone. Ma'am, if you would like some help with that, please let me know.
Okay.
Okay.
She's back.
Who said that, you? I promised to
Do
be
the
briefer
jaws
tonight.
sound. Do.
Ken's not here, so you have to.
I know. Hurry up.
You have to
Oh,
harass me.
man, I didn't even know we had another.
I was relaxed last night. It's good.
Do you have anything different? Well, I'm sure you have different.
I didn't hear what you said.
I said you have something different than other than what you presented last night, right?
You don't want to hear that again? Yes, I do. But to follow up on Freddie, I absolutely agree we should have some tracking mechanisms in place. I think we've had that conversation about, like in children and youth and all the other divisions, you know, somebody calls, you have to document everything. So not that the VA office is quite that extensive, but there's no reason there can't be a system to track, you know, I mean, as basic if it had to be, you know, name, the date they came in or called, what they needed, and the resolution. And that way, if somebody calls back in 3 months, you go into your system, you pull up their file, there it is.
Don't they have some sort of intake form?
I don't know the answer to that.
No.
I
When
don't
you
think
walk
there
in
is.
there,
I really-
you don't get an intake form.
Is there a reason for that? Is it
Well,
supposed to be
I mean,
anonymous?
it is.
No.
It is the primary services that we offer, and there's more that I would like to be doing out of that office. But the primary service is helping folks get paperwork filled out for
Right.
state and federal benefits. I mean, that for sure is the primary function. So how folks get that paperwork and what help they get filling it out certainly varies from person to person.
Isn't this some of this too? I mean, these are folks generally who are so frustrated. They've tried calling the state, they've tried calling the federal government, And I just, from my own experience talking, and a lot of relatives involved in this, I mean, they're just like at wit's end.
Sure.
And they don't even know sometimes. So you realize you can go to county, and part of what he does, that's what I meant about being on a very personal level. And I don't know, forms are fine, but it's like, help me, just help me. This is my issue. And the Veterans Office, it's almost like a homesy, folksy, and maybe in this day and age that doesn't work. But here's how we can handle you.
Please.
So it all is not well. So let me not leave you with that impression, and I'll give you an anecdote that was recently brought to my attention. There was a court hearing of a homeless veteran who was in court over some charge. I think it was alcohol-related. Happened to be related to the assistant district attorney who was prosecuting the case. And so you had Judge Sletvold, who was presiding over the case, the assistant district attorney who's been around for about 20 years here, a public defender who was representing the homeless defendant who's been around here for about 20 years. And Judge Sletvold's not been on the bench that long, but she's practiced law in Northampton County for a long time. And the homeless veteran was being released from the prison. He was cleared, his charges were over, and the judge, the two lawyers, and the homeless veteran were in the courtroom, and the homeless veteran had nowhere to go but the Allentown Mission. It was raining, and he had no way of getting there. And none of those three professionals knew that we had a veterans office. So the public defender went into her pocket to pull out $20, which wasn't a good idea, by the way, because his problem is alcohol, right? So he might not have made it back to the right. So, but she was trying to solve a problem with compassion on the spot, wherein if someone would have known because of communication, and that's an executive function, we really need to communicate to the court, hey, we've got this office, maybe we could help with that. So we have bus vouchers in the prison. So after we made about 10 calls, the guy got vouchers, and he made it to the mission. But the fact of the matter is we have this office, and nobody knew about it. Folks who should know about it. And that call could have been made very easily. So there are issues in this county with regard to veterans, homeless veterans, and veterans who have addiction problems. The other thing is that I'm sitting here listening to, and Mr. Heckman, I appreciate your point of view with it's very homesy and folksy and people like the person. And you as a former councilman, former director of human services, and current councilman feel like the people you send there get treated well, and I suspect they do. And maybe every single person who goes there gets treated well. But we don't even know who's there. We don't know who comes in. We don't know what the follow-up is. So I think what Sue is going to tell you today or sometime in the future is we're going to have a formal process whereby we know who comes in, when they come in, who they are, what happens with them, and what the ultimate discharge of the particular. That is going to happen. Sorry.
Thank you.
Can I ask a question?
Well said, yes.
Why isn't that currently happening? Like, what is the oversight of that
Well, the Director
office?
of Human Services oversees the Director of Veterans Affairs, which is at the moment Freddie and has been. So I would have to ask my predecessors why they've not.
But that
prior to you.
in the last few years. Like, I had nothing to do with veterans.
Correct. Correct.
The executive would have likely told me that if I ever recommended and had it a couple times. So, I mean, the thing is, so now it is, and I understand, it's a new time, it's a new generation, it's a new era. I mean, I know World War II guys, they're very folksy, they don't want to go do papers, and you only have two people. I hate to see the paperwork get in the way. That would be my only concern.
No, it doesn't have to be. It doesn't have to be
I
paperwork on the
understand
part
why
of
you're
the veteran. And that's the point. It's
Keeping track of who are you?
Yeah.
Can I just interrupt here? My purpose in doing this is twofold. Number one was to bring every person in front of this group so that we could hear what everybody's doing. And two, to ask what and how they're doing it. So I don't mean to disparage, and so I hope I'm not appearing like I'm picking on poor Freddie, but I mean, I have legitimate questions that I want to ask. And in the interest of transparency, I went into that office before I was elected to get paperwork for my father when he moved in. And I did not get good service. So I'm not picking on him for that. I'm asking questions. Because if that was my experience, not as a councilwoman, not being sent by Ron Heckman, then how many other people would have done that? And me seriously not knowing, my father a World War II vet, never asking and never wanting to ask before. So I'm sure there's tons of me, and there's tons of people who don't have a me Because, George is lucky to have a bulldog. Some people don't have that.
Correct.
And so, and I'm concerned when I think about that, all these young people coming in, and I hear so many stories about these young people coming back, displaced, can't get jobs. So I'm sure there's things we could be doing or other kind of networking we're going to do. I'm sorry, I'm a social worker. That's why I'm the head of this committee. So
Well-
I'll move on. Thank you. But I don't want people thinking I'm picking on the poor veterans because I love them and I have one in my house.
Well, you make a good point, though. I mean, maybe like a satisfaction thing. I'm sure there are people that aren't happy, but
And I'm not even looking for that. Listen, I'll say this and let it go before I elaborate on that point. I walk that building fairly regularly. I know who's really busy, and I know who's really not busy. And I know who could be more productive and who can't be more productive. And that's all I'm going to say. However, in social work, if you didn't write it down, it didn't happen.
That's right.
So there's no reason we shouldn't be documenting who comes in. And it's not the folks it's not our veterans, it's not our consumers who do the documenting. In this case, it's Freddie and Stephanie. And it seriously could be 6 columns of a spreadsheet. It could be very basic. That will get done. But to speak to the veteran homelessness issue, we are partnering with DCED with some rapid rehousing funds that have some limitations. We can't use it for folks in Bethlehem or Easton at the moment, but Northampton County is a lot larger than those 2 cities, and I do think that this is a place where we'll be able to help some of those vets who come in. Freddie was telling me this morning a story of a family who came in behind on either rent or mortgage because the wife was ill and they were paying on their medical bills. That's an example of funds we could use to help that gentleman, folks who struggle in the winter with their utility bills. And it doesn't just have to be vets. I mean, we will be able to use that throughout the whole human services building. So I believe we're looking at about $75,000 to be able to do that through DCED. So it's not enough. We need affordable housing in Northampton County, period.
Yeah.
Period.
Another layer of problems.
Absolutely.
Well, my question is, every time I look at you said Bethlehem East,
Why are they
through DCED and that money. Thank you. Each of those cities have their own funds. Once DCED, I know Frank was here talking about Easton and his dealings with them, and so I think in the future there'll be a joint effort there.
That's
Yeah.
why we had to form the cooperation with Easton, so that
Yep.
we could expend CBDG money in Easton.
Correct.
Yeah.
Yes. No, a joint effort, and we will be able to have more funding then. Yep. No, it's a good question. Okay.
CBDG.
Community Development Block Grant.
Okay, thanks.
Everything's
Oh,
block
B.
granted.
BG.
CDBG. Yes.
It's not a nightclub, huh?
That's CBGB.
I think I know at least 60 or 70 acronyms
CBGB's
now.
is not this.
It's alphabet. It's like what's called alphabet soup.
Sorry.
Like, oh my god.
That was in the Bowery, no?
No. I really try not to do that because anyway. Any other questions about the VA department?
No, that was really important.
Okay, thank you. Just to follow up on a couple things about Graysdale, we passed out Dawn's resume last night for DON. Were there any follow-up questions on that? Okay.
We'll take her.
Sold. I think I may have mentioned last month, our risk manager / investigative nurse, Edna, retired. I think her last day was a week or two ago. We have replaced her. We are really excited, and it's actually with someone who has done almost every single duty that Edna currently does. And it is such an odd and unique job that was no small miracle. So she's set to start, I believe, at the end of the month, and we are bringing Edna back on a very part-time basis temporarily to train her replacement, which we are really excited about. I asked Ray to form a retention committee with folks from each of the areas at Graysdale. So nursing staff, housekeeping staff, somebody from everywhere, because as administration, we've been meeting very regularly to discuss recruitment and retention efforts at Graysdale. it never made sense to me to always keep all of that on an administrative level. We need the folks who are doing the work every day to let us know what would be helpful for them. Small things. I've got Steve Barron to find some small amount of money in the budget to work on some retention activities for the rest of the year, which I'm excited about for those folks. So we're going to focus with that group on understanding the reasons for turnover when it happens, and of course how to increase employee satisfaction. And to speak to the hires, because you get the monthly breakdown from, not Freddie, Ray, sorry. But I had asked him for something about how many folks we had hired since February, that was when we really started just even initial discussions about the recruitment. So just to fill you guys in, we have hired, RNs are the most challenging. We've hired 1 RN supervisor and 5 per diems since between February 1st and June 30th, and there were no resignations in there. LPNs, between those we hired and those that left voluntarily, that was a net gain, or that was even, broke even there, except we hired 8 per diem LPNs. So at CNAs have been the most increase. We have hired 27 full-time CNAs, 6 part-times, 5 per diems, and 9 of those have, or of other folks have left or retired. So we have definitely seen improvements. It is slow but steady, and we are hoping that the job fair will really bring in a couple of either LPN or RNs. I understand Career Link was touring yesterday or the day before. Jen texted me, and they got handed, I think, around 4 or 5 resumes from folks who are already LPNs to apply at Gracehill, which would be phenomenal because LPNs and RNs are where we're really needing it. So staffing is doing okay on our first shift and our third shift. It's that lovely second shift that remains a problem.
Can I ask a question? We were talking about the tuition reimbursement and the RNs. Has there been any movement on that? Because I know it was exploring and...
No, we implemented that. There will be a press release in the future, but we met, the committee met, we had to review the applications. Actually, that was just last week. And I don't want to give away the results because I don't know if people have been notified, but we have a small number of folks who will be taking advantage of that and are hoping that for the next cycle, which will be December for the spring semester, that this will have given folks the incentive to not take advantage of calling out sick or off, because that's part of the policy. You can have more than X number of call outs, and it's pretty generous, to be honest. So I think that was part of the deterrent for some folks, was they wouldn't have met the criteria. So, but we are happy with finally at least making some headway there. Other questions about Graysdale?
I was just thinking maybe the executive has some of those gift cards floating around yet, and he could give them to you as an incentive.
No comment.
That does. Just really quickly. There is a pervasive feeling amongst the employees at Graysdale that we're understaffed. And it is true that we are understaffed for 1 shift. That is a fact. Mm-hmm. But it's the only shift we're understaffed on. And this is not new, it's not uncommon. And there are 2 things we need to understand as the policymakers and administrators with respect to Graysdale. One, you can't really change people's feelings. People feel the way they feel. Mm-hmm. But our responsibility is to properly staff Graysdale and continue to manage the bottom line. Mr. Cusick was happy to hear that Graysdale had $500,000 more than we thought we'd have, and I am too. We probably disagree about the level of county contribution, but it's in the margins. We would both agree that $6 or $7 million year after year after year county contribution would not be acceptable, and so we are under a tremendous amount of pressure to hire and hire and hire. And what I am doing is trying very mightily to hire intelligently and hire for the actual need. And this is not easy, and it's going to take time, but we are not as understaffed as some people may feel we are, and I do believe we have the strategies in place ultimately to have the proper level of staffing. And keep county contribution in that $1 to $2 million end. And I just wanted to let you know that that's where I'm coming from, and that's how I'm going to administer it.
What shift is
3 to 11.
Second shift.
3 to 11?
3 to 11.
And I have to tell you, yeah, I live in Nazareth. I get phone calls.
Yeah, 3 to 11.
How?
Yeah, 3 to 11. Can you go over and do some work?
Per diem
When you
pay.
get a call, would you,
Per diem pay.
would you go over and work?
For what?
Per diem pay.
I have a legit question, not about where you're going to find
Raises and they want.
The IGT money,
Yeah.
what impact, does that have a positive impact? I know it's going to help the bottom line, but can it help any of what we're talking about right now?
I believe so.
Okay,
Yes.
that's fine.
I'm sorry.
Thank you.
I
No,
didn't mean that.
you're fine. Interrupt away. Okay, so drug and alcohol, just a couple of quick updates. I have a candidate selected for the administrator position, and I'm just waiting on civil service for confirmation, which I do anticipate going through, and I know it won't take as long as the mental health one because they all have their own people, and DNA and aging are generally pretty rapid in their response, so we're excited about that. Our acting administrator, Beth Miller, had participated in a meeting with this isn't going to be exactly right, but the Easton Opiate Task Force probably 3 or 4 weeks ago. And someone suggested there, hey, wouldn't it be great if Northampton County had an easy-to-remember alphanumeric phone number for folks who need drug and alcohol assistance? So someone from that committee actually took it upon themselves to find out if the number 829-HELP was taken, and it was not. So we acquired that. And that will go into effect on August 1st. So we had to work out the parameters of how that would get answered to make sure that when someone with a mental health crisis found that number and called it, that it wouldn't end up in a voicemail, or so we have that being routed. But yes, it would be. That would be bad. So we worked with IT to do that. And to answer the question about costs that I was asked previously, it is $0.25 a month that Conduent said they would foot the bill for. So we got that one. Questions about drug and alcohol?
I'm sorry, I just had a question that went back to Graysdale on
That's fine.
one item that we discussed, and I don't know where it went, I'm just curious.
Sure.
Okay? Talked about the problems with the 3 to 11 shift for people. We know what that's about. We know people that are struggling with their families, they have
Right.
children, and they're single parents, things like that. We talked about the child care.
Yep.
Any movement on discussions on that?
We have talked about, I don't know that Mr. McClure and I have discussed that. I think the initial perceptions, it's not a dead issue, but the initial perceptions are that folks are not going to utilize that kind of daycare because of your child having to go to sleep and then being awakened to go home. I love the concept. If we could actually make that somehow a reality that was really workable,
Well, essentially, your kid's on second shift then.
well, correct.
Yeah.
And there's no sporting events that your kid is going to get to or that you're
Right.
ever going to get to. So
Right.
that those positions have to be filled by a
Right.
certain demographic of individual.
That is correct. And
We-
we are trying
Not
to.
me.
You're not volunteering. We are trying to market strategically to that demographic
There you go.
for that shift.
Yeah.
So,
I appreciate the discussion on that, because it's
Absolutely.
nice to talk about how to incentivize that 3 to 11 to make people want to go and stay there, feel comfortable, and do their jobs the correct way. So-
correct. Listen, I'm always open to suggestions. Liz Kelly and I are constantly. I mean, and we put that back on the staff too. We met with the union for a labor management meeting, which I thought went very well. They apologized for being rough on us. I said, if that's all you've got, we're good. And they didn't really bring up any concerns we didn't already know about. But we put it back on them too. Listen, you're the nurses. You know other nurses. Help us, tell us, give us some direction. So outside of the box or not, I'm always open to new ideas.
Thank you for that.
Thank you. Our mental health division, so Tiffany Rossnice is now integrating herself fully into that. She did ask if the drug and alcohol position was available to return to, mostly joking. It's a huge job, and she is doing exactly what I think should be done, and has been meeting with every staff and supervisor in that division. There are a lot of personnel issues and dynamics that have long been established that she and I will work together to make great and positive. So that will be a long time in the making. But some of the things that we are doing in mental health, I think I had mentioned before the roommate roundup program, so folks with mental health issues who can't afford to live by themselves, but have some sort of at least part-time job and could afford to have their own place if they had a roommate. We are working on a very grassroots pilot program of, oh gosh, I'm going to draw a blank on the name. There's a cafe-type restaurant in Bethlehem on 3rd or 4th Street.
Cafe de la.
Thank you. Appreciate that. That we are doing, so that's funded by through our mental health division. We're having meet and greets with potential roommates on, I guess, Wednesdays. I'm not sure if it's every Wednesday of the month. So we're trying to, because we have not enough affordable housing, we're really trying to think outside the box on that and solve some problems. So that has the initial phases of that has started. The Stepping Up initiative, which we've talked about before, that first meeting, official meeting, is with Judge Barada, and the rest of the crew is tomorrow. I believe you're participating, Mr. Dietz. So we're excited about that as well. And the great thing is that's a project that we already do a lot of the things to get our mental health, our folks with serious mental illness out of jail, but this will be more of a coordinated effort to really make sure we're kind of following each task to do the best job we can there. And on that line, our forensic intensive case management services that we contracted with Holcomb and Salisbury Behavioral Health, which is actually funded through Magellan, not county dollars. I think the official kickoff date is August 1st, but I know referrals have already been made to those two places. So folks in our jail with significant mental health issues, we are working on providing them with those intensive case management services before they ever get out, to make sure that they transition successfully and of course, ultimately to get them the treatment they need and reduce that recidivism rate. And back to the housing issue, we have one person at the moment in mental health who focuses on a lot of housing. It's supposed to be about 10% of her job. It's probably could be 110% of her job. So we are looking at restructuring internally, maybe to have one person who has a primary focus on housing that overlaps sort of all divisions, because there's the Regional Homeless Advisory Board, there's the Continuum of Care. I mean, it kind of goes on. And I asked, and I received today, though I haven't gotten to look at it, a flow chart of the housing kind of programs that we have in the Lehigh Valley. So I'm having a hard time wrapping my head around that, but we're working through that and hoping that if we can have one person do it, it will again, will help sort of with that concentrated effort to increase those services that we can provide. And let me see. Last, I guess, children and youth. Just to let you know, I didn't mention last night. I'm working with our HR department here. It's a hard job to recruit for because it's a civil service job that folks have to know about. So I asked our HR department, and they were very receptive. When they are visiting our local colleges, they will start to promote. They are already promoting careers within the county and the benefits of that, but also educating the social services folks, the social work folks about civil service, where you take the civil service test in an effort to try to recruit additional folks out of school, because that's a lot of who our first-time caseworkers are, recent graduates. So, so we are, again, working on any outside-the-box ways we can think of to recruit for children and youth in particular. That is all that I have.
One question.
Go ahead.
Aging, how we doing?
We are doing well. I don't have anything significant, so I skipped that part.
Okay, I just wondered because we knew there were problems, and
So
it seemed better. So
there's a good update I can give you. A couple things. We have the position posted for the protective services supervisor, and the deputy administrator position is soon to be posted for that division. I met with Laurie Grieco last week, I think, and I said, tell me exactly what we have to do to be in the green by the time the state comes back in October or November. And so she and I spent some time really tackling some of those things, and a big part of it ultimately comes down to the fact that there's a process reviewing protective services files that only she can do, because there's no protective services supervisor. I can't help her. I don't have that certification. So we've talked about ways that she can carve time out on a regular basis between now and then that she really doesn't have, but obviously has no choice but to make. And the other big piece was related to our IRIS division, or Information Referral and Emergency Services. Those folks take our initial calls related to protective services, and then they enter their information and send them upstairs to aging. And the state came in a couple weeks ago to retrain those individuals on that process. And that one is a work in process, because when the state was here, it turns out there was something that we were not doing that we should have been, that we didn't know we should have been doing. And it's just about the person who takes the call having to classify the call, as opposed to the call going upstairs and Laurie classifying. It's not a big deal, except it's a systems issue, and it's to avoid anyone falling through the cracks. So so I think if we can iron out those couple of things, we will be in very good shape.
I just had a concern that came up when Mr. Ramirez gave his talk. He mentioned that he's going to the Wolf building for storage. Why are we still paying rent? What do you know? What's the status of the lease on that? I thought we were supposed to get rid of that at some point.
Well, I think I can't answer that, but I do know he talked to me about that being the move, because they're looking to, I think, kick him out of there. I have no understanding of that. Charles, do you? Or?
Okay.
Okay.
Good.
Mr. Parsons has been working diligently to identify and remove the many things that we do have in that warehouse, which are truly varied. They are from body bags to the collection of mattresses that are left over, or I shouldn't say left over, but are surplus for the prison, so that they rotate the mattresses from there. They buy them at a larger bulk price and get the benefit from that, as well as flags and anything that the county seems to be storing in bulk, we're storing there. Clearly not the best use for us, but we are, that should be done in short order.
Well, what's the status of the lease? I mean, what are we still paying a lease for that?
We are still, a lease is still being paid for that, yes.
When can we get out of it?
I believe, as I understand from Mr. Parsons, that we can get out of that once we get our hands around the stuff that we have there now. And there's a large chess match going of where to put all these items. So once Public Works has their hands on that, we'll be out of that lease. Okay, because as maybe you know this, when we sold the Wolf building, that was supposed to be a temporary situation. Well, it's, you know, we are a over 250-year-old county, so in terms of that, we're actually very temporary at this point.
Did they specify the terms of temporary?
I have a question for
County yard sales.
I have a question for Sue. Sue, on mental health, I just wanted to ask you, how are we doing on acute treatment placements in mental health? I know at times it's been problematic since the closure of the state hospital, but how are we having problems, or has it been going okay?
That's going to be a constant problem. So when the state hospital closed, they gave us funding to have places for those folks to go. We have a short-term program and a long-term program that are much smaller in size. The deal with the state or feds is that the only way you get to build another one of these facilities is if you close another state hospital, and we don't have another one to close. And we're talking about 10 beds at one, or even 8 beds at one, and 6 at the other. It's not a lot.
So how many short-term beds do we have right now? Do you know offhand?
I think 6.
Okay, all right. I was just curious.
Yeah, and the short term is about 6 beds. The long term is about 8 beds, 8 or 10. We Deb Nunez Health Choices has worked diligently with the state, and we believe we have gotten permission to explore using reinvestment dollars from Health Choices to open another long-term facility, and we've been exploring that with some of our partners that have already done that for us and have done it very well. So it's a work in progress.
All right, thank you.
You're welcome.
I think we're good. You good?
Oh, wow.
Are you
I'm
good?
good.
Do you have anything else? Anything?
That's a
You have
question
so
you
much.
should
I
never
just
ask.
appreciate your patience and your time. I really do.
Not a problem. Thank you for listening.
I do. I do.
That's really funny.
It's a lot to listen to.
So,
I'd like to adjourn.
I'll make a motion.
Thanks for doing that. See you later.